Trauma, violence, chronic stress, and anxiety are factors impacting children and adolescents at alarming rates. While children with ACEs are not only more likely to exhibit concerning behaviors, they are also at increased risk of facing a host of negative health consequences over their lifetimes, including reduced life expectancy. As adults and caretakers, we can use our knowledge of trauma, resilience, and adverse childhood experiences to promote the healthy biopsychosocial development of all children. Being aware of the effects of adverse childhood experiences helps us understand the link or association between trauma and the increased risk of suicide. Adverse childhood experiences have a strong, remarkable relationship to suicide attempts during childhood, adolescence, and adulthood. In fact, the accumulation of adverse experiences, specifically a score of 7 or more, increases the risk of suicide attempts 51-fold among children, meaning that a child is 51 times more likely to attempt suicide if their ACE score is a 7 or above, and nearly 80% of suicide attempts during childhood and adolescence are attributed to ACEs. This information is obtained from the original CDC Kaiser Permanente Adverse Childhood Experiences research study. One of the ways that we can all begin to prevent suicide is to understand ACEs, what they are, and how to prevent them. Having that conversation with others helps to reduce the stigma. As we, as a community, become more aware of ACEs, we will begin to see an increased integration of mental health care into primary care and a reduced loss of life due to suicide. So let's delve into the basics of ACEs. The original ACE study was conducted at Kaiser Permanente from 1995 to 1997 with 2 waves of data collection. At the time of the initial study, over 17,000 members from Southern California receiving physical exams completed confidential surveys regarding their childhood experiences and current health status and behaviors. In the initial study, Dr. Robert Onda and Dr. Vincent Felitti determined 9 types of adverse childhood experiences: physical abuse, sexual abuse, emotional abuse, mental illness of a household member, problematic drinking or alcoholism of a household member, illegal street or prescription drug use by a household member, divorce or separation of a parent, domestic violence toward a parent, and incarceration of a household member. Exposure of the child to any single ACE condition is then counted as 1 point. The total score of the survey is then used as a measure of cumulative exposure to particular adverse childhood conditions. As the number of ACEs increases, the risk for health problems also increases. There is a graded dose-response relationship between ACEs and adverse mental, emotional, and physical health. In other words, as the number of ACEs increases, so does the risk for negative outcomes. The ACE pyramid represents the conceptual framework for the ACE study. This graphic shows how ACEs are strongly related to the development of risk factors for disease and physical, emotional, and mental well-being throughout the life course. Generational and historical trauma and environmental and social conditions also add to the context of how our early experiences and inherited experiences contribute to our lifelong growth and development. When we understand ACEs, we understand that when a child is exposed to severe, frequent, and unrelenting stress without the buffering protection of adult support, it can profoundly impact the body's stress response systems, which will then result in the disruption of healthy brain development. ACEs are common across all populations, though there are many populations who are much more vulnerable to experiencing ACEs because of the social and economic conditions in which those within the communities live, learn, work, and play. We now know that there are many other adverse experiences that were not included in the initial ACEs study. This includes things like chronic illness, accidents, loss of a loved one, emotionally unavailable caregivers, living in war-torn areas, living in dangerous high-crime neighborhoods, living through natural disasters, loss of a home, discrimination, racism, multi-generational trauma, secondary trauma, and even prenatal physical and emotional stressors. The reality is that adversity of all kinds, in all phases of our lives and in past generations, influences our health, and this is why increased awareness is so important. Understanding ACEs provides us with the opportunity to build upon our own support strategies. We can use this information to help decrease the prevalence, slow down worsening of health conditions, and potentially reverse chronic illness and other effects of adversity.